Hi, my name is Alan Gunther with CAO Group, and I want to tell you a little bit about a product that's coming out next year. This is our ClearVue bulb, which is our LED retrofit, and this is the world's first. Next year we will be releasing 3 different brands. We're going to do an ADEC model, a mid-mark, and an LP. So those will be the first heads that we are going to be coming out with retrofitted LED bulbs. And it's a simple plug-and-play method. Here, let me flip the light over for you. So that's actually what it is. So this is actually a halogen head from ADEC, and this is the replacement bulb that we have for our ADEC system. So most of the advantages come in the form of heat. So you used to be able to cook an egg on one of these things. You couldn't ever touch it. You're sitting underneath it all day. It's warm. This allows you to be able to simply sit underneath without having any heat issues. And then the biggest thing is the cost savings. So this product hasn't been officially released yet, but the tentative MSRP for it is going to be $299 for a replacement bulb. And we went with the color lighting of 5500, which is very similar to natural light and even a slightly blue. But look forward to it coming out in Q1 of next year. Hi, Alan Gunther with CAO Group. I want to tell you a little bit about our modern day diode laser. So we were the world's first modern diode laser to be implemented in the dental practice. And some of the things that are missing out there is what actually makes a diode laser better. And so there are many different wavelengths, and I'll tell you a little bit about the wavelength that we decided to use and why it's important in dentistry. And so we went with the 810 wavelength. We have a couple different models, a 5 watt and a 3 watt. But the 810 wavelength, and the reason why it's important is while you're using it during a procedure, be it a frenectomy, gingivectomy, or doing gingival contouring, and the big thing about 810 wavelength is the fact that it targets the melanin and the pigment in the skin, which actually draws the blood in and promotes healing. And so the biggest thing while using the laser, on top of being able to do a surgery, which you could usually normally use a scalpel for, but this is actually having quicker healing times for people's patients, which means better satisfaction. It typically means that you don't have to use as much anesthesia on the patient because the laser is again promoting healing as it's cutting the laser, cutting with the laser. And so those are big opportunities that dentists are missing out on explaining to their patients as to why the laser is good for them. So the key factor when you purchase the laser is to know what procedures it can be used. And so when you're buying a laser, it comes with a procedure manual that lets you know what recommended procedures that the laser can be used for.